Hello friends, today's video is about how to take care of your feet at home if you are a diabetic, and also to know the danger signs so as to seek proper medical care on time. As I have mentioned in my previous videos regarding a diabetic neuropathy, as you can remember, diabetic neuropathy will lead to loss of sensation, which will make the people with diabetes more prone for injuries and lead to ulceration, and then will lead to amputation. So there are certain things that we need to do, and a few of them which have to be avoided. So let's begin. First and foremost, the thing that you have to remember is to wear a proper fitting footwear. A footwear that will protect your feet and also which will stay in your feet. What I mean to say is that it doesn't slip off. So a proper footwear will be either a sandal or a proper fitting shoe. Footwears like flip-flops, slippers, tapered shoes or high-heel sandals should be avoided. Also, when you're trying to buy a footwear, kindly buy them in the evening, as there is swelling of the feet which will lead to an increase in size of the feet. Now, you might wonder that everybody wears footwear when they go out of the house. But I want to stress the point that the footwear has to be worn not just outside the house but even inside, as barefoot walking can be very dangerous and it can lead to injury of your feet. So remember, footwear has to be worn at all times, outside as well as inside the house. Also, while wearing the footwear, look if there is any sharp seam inside your footwear. Also, look for any foreign bodies that can be present within your shoe, and make sure you check it every morning before you wear the footwear. Also, always wear a socks. The next most important thing that you have to do is check your feet daily. As they are senseless, the feet cannot feel any pain if there is an injury. So every day before going to bed, wash your feet with tap water or maybe lukewarm water. Dab it dry. Do not forget the area in between the toes. And once you have dried it, look for danger signs like cuts, blisters, swelling or any other thing which is not normally seen. If you don't find anything, then apply a proper moisturizer. Take care not to apply it in between the toes, as moisture in between the toes can lead to fungal infections. The next thing is care of the nails. Make sure when you're cutting your nails, you cut them straight across and leave sufficient length, because in case you cut them too short, it can lead to injury to the nail bed. Also, it can lead to ingrown toenails. If your nails are too thick and it is difficult to cut with a regular nail clipper, then consult your podiatrist for help. Also, while you're checking your feet, if you are alone, don't forget to use a mirror to check underneath your feet. And if you have reduced eyesight, please ask for help from somebody around. Now let's move on to the things which need to be avoided. A very common practice that is prevalent is immersing your feet in hot water with salt if you develop foot pain. The risks involved with such a practice is, if the water is too hot, which you wouldn't realize because of your neuropathy, you can end up with blisters or even scars of the skin, and the problem starts there. So kindly avoid such practices. Also avoid use of water bags, hot water bags, electric heating pads, and also counter-irritant balms, which can lead to injury to the delicate skin of the diabetic. Diabetics can develop corns and calluses underneath their feet. Try not to remove them at home. Please avoid any kind of home surgeries. If you develop a wound in spite of doing all this, or any danger signs like swelling of the feet, redness, or fever, immediately contact your diabetic foot specialist. Also, things that need to be done before reaching out to your doctor is, if you develop a wound on your feet, do not keep that foot on the ground. I mean to say, do not bear weight. Second thing is not to wet the feet in water, and cover the wound with a clean dressing. And as soon as possible, seek medical attention. So diabetes management requires a holistic approach with good determination from not just the doctor but the patient himself. And the feet is usually neglected. So please remember that prevention is always better than cure. For any queries, kindly comment below or contact me. Thank you for watching.